Hello, I'm Matthew Weinstock, Senior Editor for Hospitals and Health Networks. Thanks for tuning in to our Executive Insight series. H&HN's December cover story profiles Jim Hinton, the American Hospital Association's incoming chair-elect. Hinton has spent his entire 29-year career with New Mexico's Presbyterian Healthcare Services and has been instrumental in driving the organization towards an integrated delivery model. Early in his career, he worked to align the interests between the health system and the physicians. Today, Presbyterian boasts New Mexico's largest multi-specialty group, along with the state's largest health plan. Hinton believes strongly in the migration away from fee-for-service and toward a value-based delivery system. He points out that 60% of the health system's revenue is now prepaid or capitated. I recently visited with Hinton at Presbyterian's new state-of-the-art hospital, Rust Medical Center, just outside of Albuquerque, to talk about his vision for the field and the AHA, which you can read about in the December issue. In this web exclusive, Hinton discussed some of the innovations that Presbyterian is trying out in hopes of reducing costs and delivering high-quality care.
You know, over 60% of our revenue is capitated or budgeted today, and so we really have gone beyond the tipping point in terms of capitated or budgeted care. And we see many benefits to it, frankly. We can put some programs into place that can really help benefit patients and members, can drive down costs, and almost universally maintain or improve the quality of the care that we provide. So we don't think there's any going back to fee-for-service medicine for us in this community, and we don't think it's something that people should fear around the country. It's a challenge for hospitals who don't have the relationships with payers because as they reduce utilization, if they don't have aligned incentives or shared savings, then it's going to be more difficult for them to sustain themselves going forward. Well, I think those hospitals are going to have to approach payers and to convince payers of the benefits for them of working in these shared savings models. And it's a tough thing to do, and not all the payers are willing and are interested in that kind of a discussion. But for many hospitals, especially if they're freestanding, can't rely on a broader system perspective and contracting leverage. They're going to have to go down that road. So what we've been able to do by having a system like ours, where we have a single perspective and we have a capitated model largely, is we have some programs that we are very proud of that have reduced cost and improved quality. And one of those is what we call ED navigation, where patients who don't need to be in an emergency department are navigated out to a primary care physician's office, and we guarantee a visit within 24 hours of showing up at the emergency department. And if they don't have insurance or payment, we guarantee those visits. And what we found is that people didn't know they had options, and they thought that the emergency department was their only option for health care. And we are, I think, helping to educate patients as they go through this system. Hospital at Home is a program that we're working on with Johns Hopkins. It allows patients who would otherwise be admitted to an acute care facility to actually be admitted in their own homes. And it gives them all the services of being in a hospital, significantly less cost. We see fewer falls, we see fewer infections, and patients report a much more satisfying experience. The American Hospital Association has a very, very diverse membership group. And so I think we have to do two things. One is I think we have to advocate for the regulatory compliance and payment issues that are so very difficult for our industry today, regardless of what kind of hospital you're in and what your circumstances might be. At the same time, I think the AHA has to take a very bold stand that we are going to have the finest healthcare system in the world, and we are going to stand for nothing short than an excellent healthcare system in America. And that's a bold claim, but it's one that I think the association should make, and I think it's one that our members will support. who wouldn't want to have the best healthcare system in the world, and who wouldn't want that to be an American healthcare system?
For more of my interview with Hinton, be sure to check out the December issue of H&HN. I'm Matthew Weinstock. Thanks for watching, and have a safe and happy holiday season.